Trying to make sense of what's happening inside your own body can feel, well, pretty overwhelming, especially when you're dealing with neurological conditions. So in this explainer, we're going to break it all down. We'll give you a clear, simple roadmap to help you understand what's going on.
So, have you ever had that feeling like your body's signals are just crossed? Maybe it's some dizziness that comes out of nowhere, or tremors you can't control, or headaches that just don't seem to quit. It's confusing, and honestly, it can be pretty scary when your body doesn't feel like it's yours anymore. But you're definitely not alone in this, and getting some clarity all starts with understanding the basics.
Okay, to really get a handle on this, let's use a simple but really powerful analogy. Just picture the electrical wiring in your house. Your brain, that's the main control panel, right? And your nerves are all the wires that carry messages to every single room, every appliance. If you can picture that, you've already got the main idea we're going to build on. All right, so first up, let's take a closer look at this wiring. How is it actually put together? What are the pieces that make this whole incredible system tick? So it really boils down to three key parts. First, you've got the nervous system. That's the whole shebang. The control panel, the spinal cord, all the wires. Now those wires are made up of these amazing little messenger cells called neurons. And for one neuron to talk to the next, they send out these chemical signals called neurotransmitters. It's like a tiny, super fast spark jumping from one wire to the next, carrying an order. Okay, so that's how it's supposed to work. But what happens when things go wrong, when there's a glitch in the system? That brings us to section 2, when the signals go wrong. This is where we get right to the heart of what a neurological condition really is. A wiring problem can show up in a bunch of different ways. For example, in movement disorders, like tardive dyskinesia, the signals telling your muscles what to do get all mixed up. Seizure disorders, like epilepsy, are kind of like a sudden electrical storm or power surge in the brain. Migraines? They're so much more than a bad headache. They're really complex neurological events. And then you have autonomic disorders, which can cause things like orthostatic hypotension. That's when your blood pressure suddenly drops when you stand up. That happens when the body's automatic wiring goes haywire. So what does it actually feel like when these wires get crossed? Well, the symptoms often fall into a couple of main groups. You might experience things connected to the head and brain itself, headaches, feeling dizzy, confused, or having trouble with your memory. Or you might notice issues with how you move, like shaking or tremors, muscle stiffness, or just feeling unsteady on your feet. The faulty signals can also mess with your senses, causing things like changes in your vision or numbness. And then there are the other big ones, like seizures, fainting, just bone-deep fatigue, or problems with sleep. Now, this is really, really important. These symptoms can come and go. One day might feel fine, the next, not so much. And that's exactly why tracking them is one of the most powerful things you can do for yourself and your doctor. So the big question is, why do these glitches happen? Well, the truth is, it's almost never just one simple thing. It's more like a complex puzzle. It could be something in your genetics, an imbalance in those chemical messengers we talked about, maybe a past injury, or even other health issues. A lot of the time, it's actually a mix of these things. All right, which leads us right into our third section, getting a clear diagnosis. And look, I know this part can sound scary, but think of it as detective work. It's all about methodically finding answers so you can get the right kind of help. Your doctor really becomes a detective here. They'll start with your medical history. That's step 1, you telling your story. Then a neurological exam checks how the wiring is actually working right now, your reflexes, your strength. Brain imaging, like an MRI or CT scan, is basically like taking a detailed picture of the control panel and wiring. An EEG listens in on the brain's electrical chatter, which is great for spotting seizure activity. And finally, blood tests help rule out any other culprits. Every step is another clue. So once you have some answers, the whole focus shifts. And that's what Section 4 is all about, your path to living well. This is where we get into the action plan moving forward. The first thing to know is that treatment is never a one-size-fits-all deal. It's a plan that's tailored just for you. It might include medications to help correct those signal imbalances, or different kinds of therapy to improve your strength and day-to-day function. And don't underestimate the power of lifestyle changes. Things like diet, sleep, and stress can have a huge impact. In some situations, surgery might even be an option. And that leads us to maybe the single most important idea in this entire journey, and it's summed up right here. You play a big role in managing your condition. This is all about empowerment. You're not just a passenger here. You are the driver, the most important member of your own care team.
So how do you actually do that? How do you take on that big role? Well, you start by becoming the world's leading expert on you. Keep a symptom diary so you can spot patterns. Figure out what your personal triggers are. Is it lack of sleep, stress? And then you can learn to manage them. Building healthy habits isn't just nice advice, it's a core part of your treatment. And taking practical steps, like making your home a little safer to prevent falls, gives you a real sense of control.
Now, if medication is part of your plan, listen up, because consistency is everything. It's the whole game. The do's are all about creating simple, powerful habits. Take your meds at the same time every day. Use a pill box or set an alarm. And talk to your doctor about any side effects. The don'ts are just as crucial. Never, ever just stop taking a medication or change the dose on your own. Following these simple rules is what allows the medicine to do its job right.
And all of this leads perfectly into our final section, number 5, partnering with your care team. Because the good news is, you are absolutely not in this alone. Knowing how to work with your support system is key. You know, your team is probably a lot bigger than you think. Of course, there's your neurologist. That's the wiring specialist. But your primary care doctor is there for your overall health. Your pharmacist is an amazing resource for medication questions. And therapists are there to help with both the physical challenges and the emotional side of all this. It's so important to know when to pick up the phone. And you don't have to wait for a 5-alarm fire. You should call your doctor if your symptoms are getting worse or if new ones pop up. Call if your medication doesn't seem to be working or the side effects are just too much. And definitely call if you're feeling depressed or anxious, or even if you just have questions. Good communication can stop small issues from turning into big ones. Okay, and then there are the times when it is not just a phone call. These are the absolute emergencies, and it is critical. You know these signs called. A seizure that goes on for more than 5 minutes. A sudden, severe headache, the worst of your life kind. Sudden numbness or weakness, especially on just one side of your body. Sudden trouble speaking or understanding what people are saying. Or any loss of consciousness. These are all signs that mean call 911 or get to an ER immediately. Do not wait. So, we've covered a lot of ground, and it all comes down to this one question, just for you. It's not about doing everything all at once, but just about the very next thing you can do. So, what's the first step you will take to manage your health? Maybe it's as simple as starting that symptom diary we talked about, or just writing down a few questions for your next doctor's visit. Whatever it is, that one small step is the start of the path forward.